Ready? Knock, knock, knock. Hello, Miss Johnson. And I'm doing a teaching mode, so I don't need perfection. Hello, Miss Johnson. My name is Angela, and today I'm going to feed you. Okay? Give me a minute. Let me wash my hands, and I'll be right back. Just as usual. Same thing as usual. Wash my hands. Provide privacy. Gather my equipment. And this is going to be my equipment where the teacher prepared my food and poured water. And I'm going to get my hand wipes and my clothing protector. I'm going to bring them all over here. And the first thing I'm going to do is put her head up, all the way up. 75 to 90 degree angle. It's going to be on a real person, so take the time to bring the person all the way up, okay? All right. Now we are going to check the patient's name card with her armband. Make sure it's the same. And then we are going to check the diet card with the food. So we're going to check and make sure it's the same. Got it? All right. Now we're going to ask the patient, can we put a clothing protector on? Miss Johnson, can we put your clothing protector on? She says yes. Now, the clothing protector is not on the skill set. It's not. But it's quite okay to ask the patient, do you want to, normally when you're working, you have to sometimes put a clothing protector. So it's okay to ask them at this point, okay? So there goes your clothing protector. You also have to wash the patient's hands. Okay, give me a minute. Don't turn it off, but let me get her something to wash her hands. You also need to wash her hands. So there we go, washing her hands. Good. And also, she has her mask here. Don't show the mask again, take off the floor. And so she has to have a mask on. The person will have a mask on. They're not going to take their mask off, so the mask will be on. I just want to show you what it's going to be like. Good, so the patient will have their mask on. So after you have washed their hands, I want to sit there, and you will put the food right where the patient can see her food, then you grab a chair. And you have to sit. You have to sit down. And you have to face the patient. So you have to tell the patient what is on her tray. So she must be able to see it. And you have to tell her what's on her tray. So Miss Johnson, on your tray you have a cherry, a peach, and pear. You have to ask the patient, what do you want to eat first? Miss Johnson, what would you like to eat first? She says she wants her pear. Her peach. She says she wants her peach. Okay, Miss Johnson, you have to tell her what's on the spoon. Miss Johnson, here is your peach. Good. And you have to do just that, okay? You have to ask her, what would you like to eat next? What would you like to eat next, Miss Johnson? She says she wants her cherry. Okay, there is your cherry, Miss Johnson. Very good. Now, after the second bite, you encourage the patient to have a sip of water, some fluids. Miss Johnson, here's some water. Good job. All right. What else would you like to eat? Nothing more. She said nothing more. Okay, Miss Miss Johnson. Thank you very much. You just have to move this out of the way. Then you have to wipe her mouth, just like that. You don't have to take down the mask. Just wipe her mouth and also wipe her hands. Good. And you can put that here. And then you take off her clothing protector. Good. And rest it right here. And then you give her her call-light. Here's your call-light, Miss Johnson. And then you would put the bed down in its lowest position. You're going to leave the patient sitting up, okay? Sitting up and put the bed down. Not the head of the bed, just the height of the bed down, if you had moved it. All right, Miss Johnson, thank you very much. Wash my hands and finish with that skill.